Unit 4, Biological Psychology. Presentation 8, Biological Methods of Stress Management.
Because stress is frequently accompanied by high levels of anxiety, drugs are commonly used to reduce the anxiety associated with stressful situations.
The most commonly used anti-anxiety drugs are the benzodiazepines, such as diazepam, and the beta blockers, such as propranolol. Drug treatments only tackle the unpleasant emotions associated with stressful situations, but they do help to put the individual in a more positive frame of mind, so they feel better able to deal with the cause of their stress. Let's start with the benzodiazepines, or BZs for short.
Benzodiazepines as a method of stress management. Benzodiazepines are a commonly used form of stress management. Surveys suggest that 1 in 7 British adults take BZs at some time over a 12-month period, so they must be helping them in some way. But how do they work? BZs reduce anxiety by slowing down the activity of the central nervous system. This produces an overall calming effect, and as a result, the person feels less anxious and less stressed.
BZs produce this calming effect by boosting the effect of a neurotransmitter called GABA. Neurotransmitters are chemicals that control the passage of impulses from one part of the brain to another. GABA is the body's natural form of anxiety relief. GABA locks onto receptors on the outside of nerve cells, causing chemical changes that slow down the activity of the cell, and so making the person feel more relaxed. The role of BZs in this process is to make it even harder for these nerve cells to be stimulated, so the person feels even calmer.
Beta blockers as a method of stress management. The second class of drugs used in stress management is the beta blockers. As the name implies, these work by blocking beta receptors in the body. Beta receptors are located in many places in the body, but are found in very large numbers in the heart and blood vessels. When a person is stressed, hormones such as adrenaline fix onto these beta receptors and cause changes in the body, such as an increased heart rate and increased blood pressure. These changes are associated with the stress response.
The beta blocker drug sits in these receptors and stops or blocks the receptor from being stimulated. By blocking the beta receptors, beta blockers cause the reverse effect of stress hormones, lowering the heart rate and blood pressure. As a result, they reduce the physical symptoms of stress and anxiety, making the person feel calmer and less stressed.
Evaluation of drug treatments as a method of stress management. The first strength of drug treatments as a way of managing stress is that they are effective. They appear to work, calming people down and removing much of the anxiety associated with stressful situations. Let's look at a couple of research findings to back up that claim.
Many musicians suffer from performance anxiety, or stage fright as most people know it. This hinders their playing ability when they have to play in front of a large crowd. A national survey distributed to 48 orchestras in the United States reported that about a quarter of the 2,000 plus musicians surveyed frequently suffered stage fright. The musicians said they felt better after taking beta blockers, and music critics also judged their performances to be better.
Social anxiety is when a person experiences extreme apprehension or worry about social situations or interactions with others, especially situations where they might be watched by others. The feeling of fear is so strong that they feel anxious just thinking about the situations and will go to great lengths to avoid them. Both BZs and antidepressant drugs are used to try and reduce this anxiety. A meta-analysis by Rosario Hidalgo and colleagues in 2001 compared the effectiveness of these drugs in reducing social anxiety. They found that BZs were the most effective and significantly more effective than antidepressants.
A second strength is that drug treatments are easy to use. They require little effort from the patient other than actually remembering to take them. They involve a less significant investment in terms of time and motivation compared to the psychological methods of stress management. For example, stress inoculation training typically involves a great deal of time, effort, and motivation on the part of the patient for it to be effective. Because drug treatments are relatively easy to use, then people are more likely to continue with their treatment, and so are more likely to get better. A weakness of drug treatments is that some drugs can easily become addictive. People taking BZs on a regular basis can suffer withdrawal symptoms when they stop taking the drug. Withdrawal symptoms are abnormal physical or psychological reactions that follow the abrupt discontinuation of a drug. If BZs are withdrawn abruptly, the individual can experience an increase in their anxiety levels and an increased heart rate and blood pressure level. The fact that individuals experience withdrawal symptoms when coming off BZs shows that they have become physiologically dependent on them, which makes it hard to stop their use.
Psychologically, long-term use of BZs can lead to an over-reliance on the drug and a loss of self-confidence, so that people are reluctant to stop taking the drug because of misplaced fears about how they might feel without it. As a result of these problems, the use of BZs is generally restricted to just 4 weeks at a time to prevent this dependence developing.
A second weakness of drug treatments is that they are often accompanied by unpleasant side effects. Most people who take beta blockers experience no side effects or only minor ones, such as feelings of dizziness or problems in sleeping. However, there is evidence that beta blockers can make it more likely that type 2 diabetes will develop in some people. BZs have a range of possible side effects, including increased aggressiveness and impairment of certain kinds of memory. For example, episodic memory, which is our memory for recent events, can be particularly impaired when taking BZs.
Although you might think that most people will just put up with the side effects of a drug because they are motivated to get better, this isn't always the case. Some people find the side effects of drugs, such as the BZs and beta blockers, more distressing than the anxiety that they are trying to relieve. As a result, the therapeutic effects of the drug are lost, and their attempts at stress management by this route have failed.
In conclusion, we have to remember that although drug treatments can be effective in dealing with the anxiety associated with stressful situations, they are only addressing the symptoms rather than the cause of the anxiety. However, by reducing anxiety in the short term, they can make a person feel stronger and better able to address the underlying cause of their stress more constructively. Therefore, the real value of drug treatments as a method of stress management may lie in their use together with psychological treatments, such as stress inoculation training or hardiness training.